Welcome back to Face the Nation. Nebraska medicine is known as a leader in infectious diseases. The hospital cared for Ebola patients in 2014 and treated some of the first U.S. COVID-19 patients back in February. CEO Dr. James Linder joins us from Omaha this morning. Good morning to you, Doctor.
Good morning, Margaret.
We heard a very sobering warning from the CDC director this week when he said this country is about to face the most difficult period in the public health history of our nation. And he said that's because of the stress that's going to be put on our healthcare system. What does that mean for frontline workers at your hospitals?
Well, I think the CDC director is accurate in that statement. We've been dealing with a public health crisis for 10 months now. And our healthcare workers have been at the tip of the spear in battling the pandemic, in dealing with short supplies, and dealing with a patchwork of policies that could control the virus. I think if you look at the hospitals in America, many of them are at the breaking point. Some may have broken. We had some challenges in the last couple weeks in Nebraska, but by working together, we were able to navigate that and make sure that care was available to everyone.
You know, a video from one of your nurses went viral last month, and in it she described the staffing shortages, and she described her own personal frustration that she can't just rush in and help a COVID patient. It takes time to have to put on the PPE required to even enter the room. What is it like? Can you describe what it is like to be a COVID patient right now?
Everyone should want to avoid being a COVID patient, not only for the experience if they are in the hospital, but for the potential long-term consequences of this virus. The staff has done a remarkable job in working together and using their personal protective equipment to minimize any risk of personal exposure. But it is a very challenging time. And you know, when we talk about hospitals and hospital beds, that's a very concrete number. But those hospitals and beds are not of any value unless you have the nurses, the physicians, the pharmacists, the technologists, the facilities people to deliver the care that makes people well. And those people really are stretched to the limit. I'm fully aware of this stress on the entire country and the entire world. But there's always a sense of security and peace in knowing that health care is available. But we are challenging that right now.
We're challenging that just because of the sheer numbers overwhelming the system is what you're talking about. Can you say what that means practically speaking? Are we talking about doctors having to make decisions on who to treat and who not to help?
I think that first we should realize that prior to the pandemic, many hospitals were running near capacity. And then with the addition of 20% more patients requiring care, that makes it very challenging to take care of the cancer patients, the heart disease, the strokes, the trauma that have not gone away. So healthcare providers are faced with the challenge of dealing with 80% of the patients that have those other conditions and 15, 20, 25% more, depending on geography, of patients who have COVID. So there are areas of the country that are what are called crisis standards of care, where the actual standard of care has changed because there aren't adequate staff, supplies, or other resources. We have plans for that in Nebraska, but we are not at that point right now. I want to make that very clear. But it's a very challenging time for all of healthcare.
And you have suspended elective surgeries. Would you advise other hospitals to do that now? What
we've done is postponed those procedures that could safely be postponed, say, for 4 to 12 weeks. The term elective surgery is too broad a blanket because if you have a tumor, you can maybe postpone the removal of that for a short period of time. But mentally, that patient wants the operation to remove that tumor. So the COVID pandemic is affecting all aspects of healthcare.
Nebraska's governor said that he expects to get about 100,000 doses of the vaccine during the month of December. Do you know when you will receive it at your hospitals, and what is your plan to distribute it to your employees? How do you decide who qualifies?
Well, we have begun the process of assuring which healthcare workers want to take the vaccine, and our policy would be to deal with the frontline workers in our hospital. And a lot of that is dependent on the number of doses we receive for distribution either next week or the week after.
You don't know that number yet?
We don't know the exact number yet. No, we do not.
But how do you decide? And when you say you're asking if people are willing to take it, are a large number of your employees unwilling to take the vaccine?
No, our surveys indicate well over 90% of individuals are going to roll up their sleeves on day one and be able to take it. We have to stratify the distribution of the vaccine because if there are any side effects, we don't want too many people that say would be home for a day or two.
So when you say you're prioritizing frontline, what does that mean? Because healthcare means everyone from the janitors cleaning up the room to the doctors intubating patients. Who goes first and who goes last?
That's a wonderful question, Margaret. And we will be first dealing with the people who are in the room. So your nurses, your doctors, your patient care techs, your respiratory technicians, the environmental services people that have to turn rooms over. Those are the people that should first get the vaccine. We anticipate, though, that perhaps by the end of December, if the state does receive 100,000 doses, almost every healthcare provider in Nebraska and most of the individuals who are in long-term care environments can be vaccinated. But the supply chain of the vaccine is still not solid. So we just are preparing for delivering it to everyone, but we'll see what we get.
We wish you good luck, Doctor. Thank you for your time this morning. And we'll be right back with former FDA Commissioner Dr. Scott Gottlieb. Don't go away. And we're back with former FDA Commissioner Dr. Scott Gottlieb, who also sits on the board of directors at Pfizer, one of the vaccine makers awaiting approval from the FDA here in the U.S. He joins us from Westport, Connecticut this morning. So, Dr. Gottlieb, not only are infections spiking, so are deaths. The CDC director put the number at 450,000 people dead by February. That is double where we are right now. Do you agree with that forecast?
Well, look, I think we have a worsening situation around the country. Things are going to continue to get worse for the next 4 to 6 weeks. We're not likely to see a peak in the number of infections until about the end of December, maybe into January. And we're going to see a peak in the number of deaths and hospitalizations probably at some point in the middle of January. So as bad as things are right now, they're going to get a lot worse. I think by the end of the year, we'll be at probably about 300,000 deaths. And by the end of January, we could be pushing 400,000 deaths. We're going to see consistently probably 2,000 deaths a day. And as we get into January towards the peak, we're going to see over 3,000 deaths a day, unfortunately, and we maybe get close to 4,000 deaths a day. So this is going to get a lot worse before it starts to resolve. Right now, the statistic is that about 1.7% of diagnosed cases will succumb to the infection within 22 days. That has held pretty steady. So there's a grim future right now ahead of us for the next 6 weeks. People really need to protect themselves.
Understood, and we obviously urge everyone to protect themselves. You know, last week we saw the largest surge in deaths in long-term care facilities. This is the largest surge since June. This is the elderly. If someone watching at home has a loved one in one of those facilities right now, what do you recommend that they do?
Look, I think that you need to protect the elderly in these facilities by probably not visiting right now, not having people go into those facilities. And the facilities themselves really need to be vigilant about their staff, testing their staff and making sure the staff don't walk the infection into those facilities, because in many cases, that's how it's getting into these institutions. People are bringing it in, either visitors or staff. Right now, visitors aren't allowed in most of these facilities. Hopefully, we'll be able to vaccinate these individuals and the staff very soon. The vaccines are going to be prioritized to these staffs, and hopefully the vaccines will be available soon and moved into these facilities. And one dose can be partially protective, especially in younger individuals. So the vaccines could start to have an impact right away.
Well, it's interesting you say that, because I asked Dr. Slaoui about that idea of whether to vaccinate 40 million people out of the gate, since they have 40 million doses, versus the more conservative plan of going with 20 so that they have 2 doses set to go, keeping 1 in reserve. Dr. Slaoui said it was, to be careful in case of manufacturing issues. Do you think that was the right call?
Look, I would be trying to push out as much vaccine as possible, recognizing that the supply ramps very quickly in 2021. And you have to take a little bit of a risk that the supply is going to be there in 2021 to give everyone who gets vaccinated in 2020 the second dose. This is a crisis. We need to get as many vaccines in arms as possible, in my view. And that means pushing out all the available supply, or most of it. You might want to hold a little bit in reserve, but not much. The supply does ramp. The first dose is partially protective, probably. The data does suggest that. So I think we want to spread as much vaccine as possible. If we can't get the people who get their first dose, the second dose in 2021, we're going to have bigger problems than just the fact that those people didn't get the second dose of vaccination. So we need to take a little bit of risk here.
To your point, scientists at the University of Washington estimate vaccines will save 9,000 U.S. lives before April, but they say 14,000 more could be saved if there is a rapid scale up of vaccines among high-risk individuals. What does a more aggressive push look like?
Well, we are where we are with the supply. So the supply will ramp as we get into 2021, but there's no way we're going to be able to accelerate that between now and, say, March. I think if you want to maximize preservation of life, you would vaccinate older Americans. You would prioritize vaccinating older Americans and Americans with comorbid conditions that if they do get COVID, they're more likely to have a bad outcome, more likely to die from COVID. Those decisions are going to be made very soon about who that second tranche of people to be vaccinated is. I'm talking to a number of governors, and I think governors are going to prioritize their older populations, and in some targeted populations in their states where certain communities have been hit especially hard by COVID, they'll go in and make some targeted decisions.
You sit on the board of Pfizer. As we said, Pfizer said they're not going to hit their 2020 manufacturing target. Does that mean an actual shortage of vaccine?
No, what happened was the manufacturing got delayed. There were some supply chain issues, but the vaccine that they intended to produce in 2020 now gets pushed into 2021. This is a supply chain that ramps very quickly as time progresses. So every time a week gets pushed from 2020 into 2021, you lose a lot of supply in 2020, and that supply gets pushed into the next year. So the supply stays the same. It's just not going to be available this year. But those doses, the doses that have been promised right now, have been made. So Pfizer has said that they'll have 50 million doses available globally in 2020. Those doses, by and large, have been made. And in the UK, right after the authorization, trucks rolled into the United Kingdom through the channel and actually delivered those doses. They're now sitting in the United Kingdom ready to go, and they're going to start vaccinating probably on Tuesday. And UK authorities have said they may be able to vaccinate 800,000 people in the first week.
But the idea that a U.S.-based company will start vaccinating in another country before the United States caused some consternation this week and some finger pointing at your old agency that they were slow rolling approval. Would you run this process differently?
Well, look, FDA made some deliberate decisions, I think for sound reasons, that delayed this by not months, but probably weeks. They committed to have an open advisory committee. That was to inspire public confidence and provide transparency around the approval process and the clinical data. That probably added a week or two to this process. They also required that manufacturers have at least 2 months of safety data on 50% of the patients before they even file their applications. So that delayed the ability to file an application till the end of November. So some of those applications perhaps could have been filed in early November based on the interim analysis, the first tranche of data showing that these vaccines were more than 90% effective. But the manufacturers had to wait a couple of weeks to file that because of that requirement. There's sound reasons why the FDA did that. They wanted to provide a greater degree of public assurance and also get a better look at the data. But it did delay this by a couple of weeks at least. So we just have to accept that.
So in other words, yes, you would have done a few things differently. But we will be standing by for this. Dr. Gottlieb, thank you, as always, for your analysis. We'll be right back.
Mr. President, it looks like you likely lost the state of Georgia. We're investigating. There's always a possibility. I get it. And you have the rights to go through the courts. What you don't have the ability to do, and you need to step up and say this, is stop inspiring people to commit potential acts of violence. Someone's going to get hurt. Someone's going to get shot. Someone's going to get killed.
That was Gabriel Sterling, a Republican election official in the state of Georgia, warning President Trump about the potential impact of his continued unsubstantiated claims of a vast conspiracy. Yet last night, the president repeated many of those same unfounded claims at a rally in the state of Georgia. For more on the security of the 2020 election, we want to go now to the former director of the Cybersecurity and Infrastructure Security Agency, Chris Krebs. Good to have you here. You watched that rally. Good morning. You watched that rally. I know that because you tweeted last night. And you said it was an active, coordinated disinformation campaign to undermine confidence in our elections. Why do you think the commander-in-chief is doing that?
Look, I don't know if it's intentional or if it's willful blindness, but the result of the 2020 election is clear. The key states certainly have certified over the last several days and will continue to certify in the run-up to the seating of the Electoral College on December 14th. But this race is over. We've got to get ready for January 20th and the next administration.
But just 27 congressional Republicans have acknowledged Joe Biden's victory as president-elect. That's 27 out of 249. Yeah. Why are the majority of Republicans remaining silent on what you're describing here as a security risk?
Again, I can't speak to what their motivations are, to those that have spoken up. It's the right thing to do, and I think the rest of them have to acknowledge that the system in place to conduct the election was legitimate, and particularly in the House, they've accepted their outcomes in their races. I don't see any difference here between the presidential race. It is well past the time where all leaders of the Republican Party need to accept the outcome of this race and move on and accept that Joe Biden is the president-elect.
When you say a disinformation campaign, I mean, you're looking at this from a national security point of view, where you were trying to stop foreign governments from undermining confidence in our elections. What do you think the consequence of this coming from the president of the United States is on our democracy?
I do think it's corrosive to confidence in the election, in democracy. You know, the point of elections, it's often been said by election officials, is that you're trying to convince the loser that they lost. But to do that, you have to have willing participants that are honest brokers. And we're just not seeing this right now. You know, every court case or filing has been rejected by the courts. And so any fraud claims, any security claims, any sorts of things along those lines, we're just not seeing supporting evidence. And again, it is time to move on. You should have confidence, particularly Georgia voters should have confidence in the election, and they need to get out for the January 5th Senate runoff.
You have described yourself as a lifelong Republican. You served President Bush. You served under President Trump. Why do you think the party's scared to do all the things you're laying out?
I don't know what is behind this, what their motivations are. But again, it is time for leaders in the national security community and in the Republican Party to stand up, to accept the results and move forward. We cannot allow this to continue, certainly not past January 20th, certainly not for the next 4 years. Any sort of lost cause movement would be just horribly destructive to democracy. So
in your former agency, before President Trump fired you, you had a variety of responsibilities on the cyber front. And you've talked about disinformation online around the vaccine, for example. We know the State Department has quietly called out Russia for spreading disinformation about the vaccine. Why isn't Homeland Security right now launching a campaign to educate the American public about a vaccine being safe?
So early on in COVID, in fact, it was March 13th was the day I think the world changed for most folks. We launched an effort to both help the vaccine developers as well as the public health care institutions, hospitals, the protective equipment manufacturers, and yes, the therapeutics and vaccine developers. We launched a campaign, a cybersecurity focused campaign to secure their businesses and their enterprise. But at the same time, we saw some disinformation emerging related to the coronavirus, and including just farcical claims like 5G telephone towers spread the coronavirus. So we actually saw vandalism in the United Kingdom. So we wanted to get that here. FEMA did launch a similar rumor control effort on the coronavirus. We are going to have to do much more going forward to counter the vaccine claims that we're going to hear, the anti-vaxxer type claims. Those have been previously and will be in the future supported and amplified by foreign powers that don't share our same interests. So we need to get mechanisms like that up and running fast.
How much of that is foreign? How much of that is domestic?
It's hard to say. There's certainly both. But the more that we get professionals like Dr. Gottlieb, who I worked with closely back in government, the more we get professionals like that out there describing the facts about the vaccine, that's going to be one of those critical aspects going forward.
Homeland Security disclosed this past Thursday that cyber attacks are underway at companies and government organizations involved in distributing the vaccine. IBM went public, saying they were very sophisticated, which indicates that a country, another government, was possibly behind it. Who has the ability and the intent to do something like that?
So the traditional powers, the big four of Russia, China, Iran, and North Korea, we have seen to some extent all four of those countries doing some kind of espionage or spying, trying to get intellectual property related to the vaccine, and in fact just how we're doing as a country policy-wise and in terms of health impact. What we had been thinking through at CISA was not just the vaccine developers, but their entire supply chain, and really trying to look through those for those critical weak spots. We called it the ball bearing strategy, looking for those key elements that could cause the entire process to collapse. And that's going to be critical going forward. So it's not just about Moderna and some of the others that are developing the vaccine. It's their supply chains, it's the distribution channels, public health institutions. Those are the folks that we have to continue to spread cybersecurity support to from the national security community and from the private sector.
All right, important message over the coming weeks. Thank you, Chris Krebs, for joining us today. And we will be back in a moment. That's it for us today. Thank you for watching. Until next week, for Face the Nation, I'm Margaret Brennan.